Hello and welcome to the Doctor's Inn. I'm Marcia Boyles and I'm delighted as usual to introduce the star of the show, Dr. Kamaljit Sethi. Many of you know Dr. Sethi. She is over at the medical center, one of the four physicians
That's
over there,
right,
Dr. Sethi. We're delighted today to introduce a topic that is extremely relevant to our age group, and the topic is falls. Dr. Sethi, why do you think falls are a really important topic for this resident population?
So falls are very important in our demographic because we've got folks that are getting older. Now, of course, we're getting older from the moment we are born, but as folks get into their 60s and 70s and 80s, the risks of falls continues to increase. Mm-hmm. So it's also one of the very common problems we encounter at the medical center, one of the reasons for many acute visits as well as visits to the emergency room. So it seemed to be a good idea to talk in a positive way, to sort of scope the problem first, and then to look at, what are the risk factors, who's likely to fall. Thirdly, to talk about how we should be assessing people for falls, because falls can be associated with fractures, and preventing fractures is not about treating osteoporosis, but it is about preventing falls. Mm-hmm. So prevention. And then once we do that, some special considerations. And then we'll sort of close with that to round out the whole thing so that everybody has a good feel that a fall is not unique to them, it's a common problem, and they may be preventable to a varying degree.
So it's not inevitable. Mm-hmm.
That's correct. Mm-hmm. That's correct.
All right. Well, that sounds like absolutely something we should all pay attention to.
All right, so let's start off by talking about the scope of the problem. When somebody falls, what does that tell a medical professional? Falls are a sign of frailty. They speak to us about immobility, and they speak to us about the presence of acute and chronic medical conditions that may be predisposing the individual to a fall. Okay, so a fall isn't just something mechanical. Somebody trips, somebody falls over a chair or hits their head against something and falls. It is much more significant than that, and that's important to bear in mind. Secondly, falls are often associated with injuries. The good news is that usually they are minor injuries. I say minor, although they may end up being, very time-consuming and bothersome, but minor in the sense that they are bruises, there could be skin tears or lacerations. If they're lacerations, they need to be stitched up, and one could have hematomas or accumulation of blood. That's basically a bruise, but they can be large. I mean, sometimes we see really bad bruising that can occur over the back or the leg, and if you look at the leg, for instance, the bruises can be very large because there are large areas that can get bruised. So the most serious injuries, of course, are fractures and death. But just looking at fractures, they account only for about 3 to 5% of all injuries, and that is very fortunate that we don't get that many fractures. That's the good news. The bad news is that there's a lot of morbidity associated with falls. So to put this into perspective, falls are the leading cause of injury in those above the age of 65. Now, we may not quite think of it in that way, but if you just pause for a moment, you immediately realize that that is the case. When does an older person get an injury? It's generally when they fall or they hit something, right? They're also the leading cause, amongst the leading causes of mortality in those above the age of 65. So it's not the fall that causes a person to die, but it's all the consequences, the sequelae of the fall. So in other words, if you fall and you sustain a fracture or you have a hemorrhage, that can ultimately lead to other complications that may cause you to die. So really it's in combination with all of those things that it becomes a cause of mortality. It's sort of the final event, if you would. So for all of those reasons, falls become a very important part of where we should focus our attention. At all times, it's helpful to first make an observation. Falls are common, right? We've already established that. The next step is, if falls are common, do we know what's causing the falls? Because if we can identify risk factors, then we'll know how to prevent them, right?
Makes sense.
Yeah, yeah. So then our next segue into is the very next thing we wanted to discuss, and that is fall prevention. Or
Yes.
rather risk factors, I should say. What can cause you to fall? Some things are under our control and some are not. So we can think of them very simply in two ways. Let's first think about the extrinsic factors, and then we'll think about the intrinsic factors. So extrinsic factors, and you may have something to say about this, what are the things external to your own self that can cause falls? I know that you've spoken about scatter rugs before. Yeah. So scatter rugs are important. Any uneven surface is important. So pavements. So for
Yes.
instance, pavements are a very big problem because they tend to get uneven. As a complete aside, in New York City, the commonest reason for torts for the city are uneven pavements because
that
people
right?
fall. Yeah, and it's not even anybody. It's not a particular demographic. These are all people of all ages because the surface. So this is a surface hazard, just like the rug. Okay, uneven surfaces. Traffic flow patterns. So we are sitting here in this room. If I'm going to walk out of here, the first thing I have to do is I have to move my chair aside and I have to walk around the table, right? So if there were a camera sitting somewhere which interrupts that traffic flow, if I'm distracted, there is a risk that may bump into the camera and take a fall.
Or there could be cables on the floor.
Or cables on the floor. And the same thing is true in an apartment. In an apartment, the things that cause poor traffic flow include, as you walk in, you've got a couch and then you've got a table in front of the couch. The table is causing poor traffic flow because it doesn't allow you to go straight to the couch. And if you're using an assist device, that may get caught in the leg of the table. So those end up being important external factors, and they're controllable to a degree because how you place your furniture really depends on functionality and, in this case, I should say, safety, right?
Yes.
So, we have to be much more careful with that. The other two things that we need to talk about, and this is very important now, this is a medical issue, the medicines that one is taking. And included in the medicines, the one that I want to highlight are sleep medicines and the psychotropic drugs. Now, if we have to take psychotropic drugs, so be it, because some individuals do have to take them.
Give some examples
So,
of psychotropic.
example of drugs that we might take might include those for anxiety and agitation. So when
sedative types.
and then the hypnotics would be the sedatives, the sleep medicines. So if you're taking, for instance, a Xanax and you're used to taking it, that's okay. But you have to remember that this may impair you mentally somewhat,
Yes.
and you may be more likely to trip. A common example, for instance, is even a medication like Benadryl. We don't want folks to just go to the pharmacy and take some Benadryl to sleep with. Forgetting other side effects, just the drowsiness is going to make you less alert, more likely to fall. So we need to be aware of all of those medications. Now,
And the sleep medication that you mentioned when we talked previously
Yes.
was Ambien.
yes, and Ambien is notorious for that. In fact, so serious is the drug problem in association with falls that the Ascension Health System, which is the second biggest health system in the country after the VA health system, took an initiative at all its hospitals and nursing homes, continuing care facilities, to reduce hypnotic use. We did the same thing here at Green Spring. And
Yes.
it was a great effort because we tried to reduce the amount of Ambien that people were using. On the one hand, you've got an individual who comes and tells you, I've never slept this wonderfully my whole life as I slept with that Ambien last night. But then on the other hand, that same Ambien may cause people to sleepwalk and do all kinds of bizarre things, including drowsiness, a hangover the next day, which may further increase your risk for a
I would
fall.
think, yes.
And you know, the medicines are a crossover. They're extrinsic, but they're intrinsic also because they're contributing to other problems that may occur with these drugs. And then lastly, because it is relevant to our demographic, I should mention the use of assist devices. The appropriate of assist devices is important. So if you have a walker and there's a table leg and the walker gets caught with the table leg, then it's likely to tip over. And if you're holding on to it real tight, which you should because you don't want to trip, but at that moment, that may tip you over as well. So the proper use of the assist devices is important for your own self and for the safety of others.
Yes, and we certainly do see folks who clearly either have inappropriate assistive devices or don't know how to use them.
Right.
And outpatient rehab can always be contacted to help with that.
Yes, yes, and we should recommend that to everybody who has an assist device to be sure that, I mean, it's no different than driving a car or a boat.
Exactly.
You know, I won't say airplane because we're not doing that.
No.
Although there are many who live here who've had pilot licenses in the past. So safety is the key there.
Yes.
So the extrinsic are controllable to a degree. So let's move on to the intrinsic factors. What else can be happening? And again, to think about it simply, we can think first and foremost about something that occupies everybody's attention and everybody's familiar with, and that is, what is your blood pressure? So most people are very concerned with their blood pressure being high
Yes.
because they think they're going to have a stroke. But I would submit to you that based on the scientific evidence and the data and personal observations, that a low blood pressure is a far greater risk than a high blood pressure.
In an overall sense?
In an overall sense, because if the blood pressure is low, when you're sitting down, when you stand up, it may fall further, what we call postural hypotension, and when it falls, it may make you dizzy, albeit briefly, and you may fall. So it is a far greater risk. What is the level of blood pressure where one would be concerned that this may actually happen? It's somewhat variable, but if it's certainly less than 100, then it's of concern. Now remember, a blood pressure of 100 in someone who's 85 years old is totally different than in a young woman who is 40 years old. So because blood pressure tends to rise with age, so it sort of has a different set in terms of what is normal than in someone who is half that age. So a low blood pressure. So low blood pressure, it may be intrinsic because you've had low blood pressure your whole life. That one is less risky. The one that is more risky is the one that's the crossover from the extrinsic factors, and that is medicines that may lower your blood pressure. So medicines that may lower your blood pressure include, of course, blood pressure medications. We may be over-medicating you. We do not want your blood pressure to be 110. That is not your safest blood pressure. If it is, then we want to reduce the dose of the medications to a degree, okay? Or at least be sure that when you stand up, your blood pressure doesn't fall so much. The second category of drugs are some of the Parkinson's drugs, and there's a lot of folk with Parkinson's,
Yes.
can also drop blood pressure. And there's a whole slew of drugs. There's heart failure medications, there are fluid pills. So we need to be mindful, and we need to provide the education around it, and we need to, as providers, continue to educate ourselves going forwards every time we use new drugs to make sure that if they drop blood pressure, that we A, apprise you of it, and B, you remain aware of this as being a fall risk for you. Okay, so that's the big one. So chronic health problems, and very significant amongst the chronic health problems that can cause blood pressure to be low, include diabetes. Now, most diabetics do not have low blood pressures, but they can. But another problem that diabetics can have that can contribute to this is neuropathy. Now, we're used to thinking of neuropathy as tingling and numbness in the feet and legs, but neuropathy is much more than that. That is peripheral neuropathy. You can also get a neuropathy in diabetes where your blood pressure is actually low. So between the peripheral neuropathy, where you don't feel the ground under your feet well and you may fall, you've also got then the risk that your blood pressure may be low. So diabetes remains particularly problematic because of its many and varied complications. So apart from the blood pressure and the general health problems, the next category under risks are mental problems or cognitive problems. So what are these problems? Amongst these, we've got cognitive impairment and dementia, where you may not really fully understand what's happening around you. Depression, now most people don't think of depression as being associated with falls, but it is. And
How does that work?
yeah, so the reason depression may cause falls is, in general, when folks are depressed, they detach themselves from their environment. They become much more introverted. They're less aware of what's around them.
Okay.
And that may be the reason why those who are depressed tend to fall more. Okay? So those are the two serious issues. Then the sensory deficits, which are part of aging, hearing problems,
Yes.
visual problems, those are a given. We understand those well. Attending to cataracts timely, because cataracts can obviously cause visual impairment too. And so attending to those in a timely manner and proceeding with surgery as indicated. Two more to mention. Incontinence. What a common problem incontinence is for us.
Yes.
So the reason incontinence may be associated with falling is if you have an urge to go and you want to get to the bathroom quickly, we know what happens when you get up quickly and you try to go somewhere quickly.
Particularly in the middle of the night.
Particularly in the middle of the night, So that increases the risk of falling. Now, our viewers may be wondering why the most obvious cause or risk factor has not been mentioned, and that is age. Age is not an independent risk factor. Age is a risk factor because of all of the problems we mentioned.
Okay.
You know, if you don't have visual defects, you don't have hearing defects, you don't have balance issues, you know, you don't have diabetes, you know, your medicines are all good, or you don't take any medicines, you're much less likely to fall. So it's not just the chronological age. It doesn't matter if you're 90. What matters
Okay.
is how are you doing medically? What is your physiologic age?
Right.
Make sense?
Definitely.
Yeah,
Definitely. And there are a few exceptional folks who don't have any of those
Yes,
risk factors, but not many.
Yes, yes. So that's a lot of information, but I like to sort of think of it simply by saying just think of your medicines and blood pressure. Think of what, whether or not there's depression and cognitive impairment, and then lastly, think about visual and hearing problems and the risk and the fear of falling. If you're afraid to fall, you're more likely to fall. Okay. All right. So I think it's time for us to move on to the couple other things we want to talk about as we're getting close to our time. So everybody who has a fall, when you go to your doctor and you've had a fall, what needs to happen? You're going to have an assessment. You're going to have an assessment as to why you fell. And the assessment has many components, right? The most obvious one is the physical one, right? And then an assessment of your mental health. Are you depressed? Or do you have cognitive impairment? Social assessment. Are you by yourself? Okay. Economic. Do you have the assist device that you need? Right? Functional. What is your posture? I ask everybody who comes to see me, fall or no fall, to walk to the door. It's just a few steps, but I'm able to see, are they standing straight? Is somebody leaning to the one side? Is the shoulder leaning over? How is the spine looking? Because that's going to change the force of gravity for you and make it more likely that you'll fall. And then, of course, environmental. Recognizing surface hazards, being sure that we understand that as your provider. So once we've completed the assessment, then we get to the part, which is to say, can we prevent you from falling again? And so the data shows that we can prevent falls. You know, the studies have variable results. Anywhere from 15 to 60% of the falls can be prevented. Yeah. So that means that we can have a good yield. If we can prevent 1 out of 6 falls or 1 out of 2 falls, that's great. So all of this is repetitious because we keep coming back to the same things. What can you do to prevent falls? You have to become strong. How can you become strong? You have to have exercise. You have to have exercise, exercise, and exercise. Okay. You have to.
I think we've talked about exercise before.
Yes, we have. Yes, we have. You have to have calcium and vitamin D because they're going to make your bones stronger. They're not necessarily going to prevent the fall, but they're certainly going to be beneficial in terms of any injuries that might result. So you have to have calcium and vitamin D. Your physician and you should both look at your medications, the medication review, the hypnotics, the blood pressure medicines, really, really important. And that's, you know, the low-hanging fruit, because if you can correct that, you can alleviate a significant problem, right? Making sure that you've had eye exam and your hearing, and those are in good order. And then I want to talk about something which, again, we can't absolutely speak to, but it may be of value, and those are hip protectors. So hip protectors are just sort of like little boards which are built into a brief, and when you fall, they'll protect your hip. So the data...
I have never heard of those.
Yeah, so those are recommended in facilities where there are a lot of falls, which would mean assisted living facilities and long-term care facilities, more so than independent
People
living.
who are particularly frail or vulnerable.
Yes. So are we ready to say that everybody should have those? No. Not at all. But it's certainly something that needs to be thought about. And I just wanted to create that awareness for folks, certainly who've had one hip fracture. Hey, listen, it would be a worthwhile investment. Would not be covered by Medicare, but so what? It's modest. It's less than $100.
And these are actually briefs.
Yes. I mean, I actually have not seen one of them. I've only seen pictures, and you can go to Dr. Google and you can look up whatever is available out there.
Okay, so hip protectors.
Hip protectors, that's right. So, because we have to wrap up pretty soon, I think that you would agree, Marcia, that falls are a common problem. Because we have many who are frail, but even if they're not frail, they've got chronic health conditions, mobility problems, which create a risk for falls. A special group that we have to be attentive to are those who take blood thinners, anticoagulants, and it doesn't matter what they're for. If you're on a blood thinner and you fall and you hit your head, you're at risk of having a hemorrhage. You may have a subdural hematoma, which means blood collection out, between the skin and the skull, or you may have a hemorrhage which is inside. So very high risk. And lastly, the financial cost. How expensive are falls? Would you venture to take a guess?
I would not.
And the numbers are very variable. $7 to $10 billion to $34 billion a year. I don't even count the number of zeros. Once you're in the billions, you've got a billion too much.
Right.
So to me, it says that in addition to the loss of independence and the injuries that come
Yes.
with falls, they're very costly for us as individuals.
Yes.
Collectively is one matter, but as individuals.
Yeah.
And whatever we can do to prevent them and educate ourselves would be a worthwhile effort.
Yes, I think our population is very aware that we're all vulnerable to falls.
Yes.
Every one of us. Well, you had some statistics on how the frequency of falls.
Yes, so I'm going to look at this to be sure that I say it right to you. So every 11 seconds, an elderly person falls and is seen in the emergency department. I should
11
I should
seconds.
rephrase it. Every 11 seconds, an elderly person is seen in the emergency department for a fall.
For a fall.
Yeah. The second statistic, which again is very striking, is that every 19 minutes an elderly person dies from a fall,
Whoa.
which again, is a very high number.
Oh, incredibly high.
And amongst the falls, the most serious injuries being fractures, and of the fractures, the most serious fracture being the hip fracture.
Yes.
If you should happen to have a hip fracture, there's a 20% risk that the individual will die within 1 year from a stroke or a heart attack or other complications. So the awareness of falls is certainly there, but what we need is to empower ourselves with the knowledge.
Yes.
Ask every time if you've had a fall, do my medicines need to be adjusted?
Right.
Am I taking any sleeping pills, anxiety medicines? Do I need to deal with those? And then we need to ask, is your apartment safe?
Well, and also, do I need eyeglasses or cataract surgery or a hearing aid or whatever?
A hearing test. A hearing test. Above the age of 85 is probably essential for everybody. Not because we think so, but because we want to know so.
Yes.
If or not there are any sensory deficits. So I think that there's a great room for improvement and reducing the number of falls if we bear all of those things in mind.
Yes. Well, I think this has been extremely helpful. We normally don't think about this in context of our overall health, and this really has been I think kind of an eye opener this morning.
Well, good. I hope it'll be useful.
I certainly think it will. Dr. Sethi, is there anything you'd like to close with, or are you pretty much?
I
do you
think
feel like
that
we've covered this pretty well?
I think just to reiterate what we spoke about the fact: A, they're common.
Yes.
B, they're costly. C, serious injuries are low, but can be very dramatic, including serious fractures.
Yes.
We spoke about the risk factors, looking at the external factors, looking at the intrinsic factors, which should be your own medications, your blood pressure. Know your blood pressure. Be concerned about that low blood pressure. If there are 3 things I want you to remember from today, they are essentially: know your blood pressure and know that a low blood pressure can be of great risk to you. Know that if you take sleeping pills or other anxiety pills, that those may pose a risk for you. And remember that if you're afraid of falling, then you've got to take a step back and consider that in and of itself may create risk for you. And if you take a blood thinner, you're the most vulnerable person if you hit your head to having serious problems.
Well, I think with that wrap up, we will stop. This has been extremely helpful. Thank you, Dr. Sethi, and we'll look forward to continuing this program with new topics.
Yes,
if you have any suggestions, either Dr. Sethi or I would welcome your comments.
Yes, and indeed, we do need your feedback. We need to hear from you. You need to tell us what you consider to be a problem, and we can certainly look at bringing that to you in the future.
Thanks, Dr. Sethi.
Thank you.